Is it your first April conference at the High School of Economics?
Yes, this is the first time that I am in Russia. This is the first time that I am in Moscow. I am very happy. You have a very nice city, very good people. Thank you.
Why did you decide to take part?
First, they invited me. Second, I liked to see Russia. I like to discuss with the Russian scientists that you have a very high level of science and knowledge in your country. For me, it was very good to get familiar with this group.
As you report, could you tell us about the main diseases that become the leading cause of mortality in Russia nowadays?
Actually, the main causes in Russia is ischemic heart disease. And ischemic heart disease in Russia is very high, and I have to say that it's highest in the world. And when we look to the ischemic heart disease and cardiovascular disease, we will see that a big part of risk factor of this disease is alcohol. Alcohol is the main risk factor for the cardiomyopathy, especially alcoholic cardiomyopathy in Russia is very high. And your top problem is consumption of alcohol. This is based on all of our analyses in the global burden of disease.
Russia had the highest rate of alcohol use and drug use. Is it among the countries with the similar level of development? Is it right?
Russia has a highest consumption of alcohol, that is correct, but it doesn't have highest level of drug abuse. Drug abuse in other countries is a little higher than Russia, but anyway, these two problems, yes, this is a big problem in Russia. Especially, you know that number of deaths in young age and middle age in Russia is a little high, and mostly are due to the alcohol and drug abuse and some related causes to these risk factors.
What measures should be taken to reduce these figures from your point of view?
Actually, I am not responsible to answer to this question, but this is just my personal opinion that the best thing that Russia have to follow is taxing of alcohol. Taxing of alcohol is the most important thing that Russia have to follow, because it is a very big problem. And different experience in the 2000 and before 2000 shows that when you started to campaign against alcohol and taxing number of deaths due to the cardiovascular, due to the alcohol use disorder and cardiomyopathy dropped a lot, and this is important. Historically, alcohol in Russia is a problem. From 19th century, I know that Russia has a big problem of alcohol, and this is not something that we cannot protect people against that. We can do that, and I think this is one way that taxing of alcohol.
To your mind, what advantages and disadvantages has the Russian health system?
The most important thing that we should consider, Russia passed a very different big crisis of USSR collapse, crisis of the different situation after the USSR collapse. But the most important thing that your child mortality under 5 mortality is going down. It means that your health system worked well in this area, especially for the maternal and child health. But when we move from maternal and child health, we will see that no, there is big problem in the middle age and in the old age health system didn't work very well because there were many crises that people used alcohol, people used drug, people used crime, people used suicide, commit suicide, and then number of deaths in Russia is high. If you want to increase your life expectancy, there is one way, just control alcohol. Otherwise, you cannot increase life expectancy in your country.
Thank you for your answer.